Good evening, everybody. Welcome to our RCN Wales webinar, our update on the Welsh Government pay offer. So I am Jackie Davis and I'm chair of the RCN Wales board, but I'm also a local steward here in Wales. So again, thank you very much for joining us this evening. Before we go on, I just want to take the opportunity to remind everybody of the RCN Respect Charter. This is a professional space. We're here to listen and learn from each other, and it's important that we are respectful during these debates and these discussions. So also, if you can be mindful of your NMC code throughout, it's important how we conduct ourselves. And the value of being kind is important as we share and debate these key issues. So in terms of the agenda, obviously the purpose of the meeting is to update RCN members on what progress has been made so far on the 2022-23 pay offer. And members should have received a bulletin via email with the update. And this webinar is just another way of us keeping you involved in what is happening on those non-pay elements. And some of your questions may be some clarification on some of the information that we have sent you via email. So without further ado, I'm now going to pass you on to RCN Wales Director, Helen.
Good evening, Noswaith Dda. Nice to be online with everybody today, and thank you, Jackie, for your warm introduction to today's event. I'm Helen Wiley. I'm the Director of the Royal College of Nursing here in Wales, and it's my pleasure to be the chair for this evening. So thank you all for joining. A few housekeeping rules before we get started. To tell you that this is a recorded session and that we will be using some of the answers to the questions that the panel give us on social media and other outlets that RCN Wales uses. This is just to make sure that members who've missed this evening's event can catch up on answers that are of importance to them. I'm going to introduce the panel before we go into the presentation, just so that you know who else is going to be answering questions for you this evening. So I will just say a little something about Jackie, because she's already said hello and how she's a steward and the chair of the board, etc. Jackie's background is in mental health nursing and forensic psychiatry, and she's also a board member on her local health board, taking the trade union seat. So we're really pleased to have Jackie with us this evening. Alongside Jackie in the hotspot, when we get to questions, will be Nikki Hughes, who's the Deputy Director of Nursing for Employment Relations here at the RCN, and she looks after the functions with regards to employment relations, and that of course includes pay, and she's our lead negotiator with the Welsh Government and the employers on NHS pay. So I'm sure you'll have some really great questions for Nikki. And then alongside Nikki is Kelly Andrews, and Kelly has joined us recently from the GMB union, and Kelly's an expert in organising and pay, and has a very strong background in healthcare and particularly in social care. So again, delighted that we're going to have Kelly on our panel after our presentation. So just to let you know how you can get involved, at the top of your screen you should see a Q&A function. So please open that Q&A function and type in your questions where we can publish them, and then when we get to the point of the panel discussion, I'll be able to put your questions over to the panel. You should be able to see the Q&A at the top of your screen. So to give us a real update on where we have got to with the pay award from last year, I'm going to hand over to Nikki, and Nikki's got a number of slides for you, and while she's presenting, we will also drop into the stream for you some links, both in terms of where you can find updates on this from the RCN's website and also from the NHS Partnership Council social partnership hub as well. So get ready to type your questions whilst Nikki's going through the slides, and then we can have a really good question and answer session on the information that she's going to share. Okay, thank you. I'm going to hand over to you now, Nikki.
Thanks, Helen, and thank you for attending today. It's lovely to see members coming to hear where we're at with the non-pay elements. And I think it's fair to say that we're not really at a point where we wanted to be. A lot of the work has been stalled over time, and although I particularly have been in my role really pushing Welsh Government and NHS employers to keep to timeframes, to implement the things that they can do. Unfortunately, we're at a point now where we're at the end of March. They have committed to implementing the wording of the pay award for 2022 to 24, but actually as we go through you'll find that quite a few of the elements won't be implemented, even the wording, by the end of March. We have a final meeting tomorrow whereby we will be going through for a final review of where we are at, and we will be able to update you further in the coming months around what the work is being done. What we have got Welsh Government to agree is that they will issue a Welsh Health Circular to organisations to ensure that this work is taken forward and monitored in a proper and robust way. So if we look at the working hours element of it, so this was the 36 hours. Now, if you remember, the wording of the award was that a feasibility and affordability study would be completed. That work did not progress. I think there was a view of waiting to see what Scotland did, to see if Scotland got this over the line. And unfortunately, even though I've been asking for work to be undertaken in the interim, unfortunately that wasn't done. So there is the final milestone review tomorrow. What is being we had a very high level 1-page report on this, and I went back to Welsh Government and employers and said that wasn't sufficient. It wasn't a proper feasibility study, and they need to go away and do a proper scoping of this. And they have agreed now to go away and do a proper feasibility study and look at the Scotland model as well. Now, what I've asked for is very clear timeframes on that, very clear targets of where that should be undertaken, and I will be making sure tomorrow that I have those assurances that we know that this isn't going to go on for 2 years, as you can see happened in Scotland. So very disappointing, but at least we've now pushed it forward to get a proper review of this done. Next slide, please, Rob. So the unsocial hours payment, so this has been implemented. So if you remember, this was about having unsocial hours payment after 1 week of being sick. So for the first week you don't get them, but then after that you would get unsocial hours. That is continuing. We've managed to negotiate that is going to continue. Obviously, our mission as trade unions is to actually say, well, actually, it should be no weeks. You should get your unsocial hours payments right from the start of being sick. So that will be what we'll be pushing on that. But at least they didn't revert it back to the 3 weeks, which they said that they may do on review. So that's a positive. The career progression work, again, this is ongoing. It's something that Health Education and Improvement Wales are looking at, and I'm very much involved in the working groups to look at how people can progress from a band 5 to 6 in an automatic way through competency-based learning and training, exactly the same as midwives do, exactly the same as Welsh Ambulance Service paramedics do. So that work is ongoing. Again, it's not gone as quickly as I want, but we now have a very robust framework in which we're going to take this forward. We've got regular meetings in place. So again, I'm really disappointed that this didn't happen sooner, and I've been asking for this to happen, but we're in a position where there is a framework of how we're going to take this forward. So we're in a better place than we were maybe a month or so ago. Next slide, please. So reduction in use of agency, that's ongoing. That's going to be an ongoing issue. We're hearing from all the health boards that actually their local work that they've been doing is showing now a reduction in agency. What I'm not seeing, and I did pick Welsh Government up on this last week again, is any sort of meetings to discuss enhancing bank rates so that people get a fair amount of money for doing a bank shift. Overtime we'll talk about in a moment, but if you do work bank, that you get enhanced rates, so that would hopefully sort of incentivize people to do work in their own organisation rather than going for agencies. So that is coming down, but obviously that's going to be a long-term aim. The flexible working, we have said that's implemented, and if you look at the wording of the award, yes, okay, there is a flexible working policy. It has been implemented into practice, and information has gone out to health boards around a statement saying how that should be used. What we're hearing from you, though, when we're coming around talking to you out in your clinical areas, actually you're still not seeing your managers agreeing to even look at a flexible working pattern for you, let alone agreeing it as a default. So if you remember, it was everything should be done to make sure that it's a yes to having flexible working, not a no. But what we're hearing from you is that that's not being done in sort of reality. And again, I've been feeding that back up straight up to Welsh Government and indeed to the Minister for Health and Social Services. Next slide, please, Rob. So overtime payments. So again, this is a bit of a frustrating one for me, because this is actually part of your terms and conditions already. But what we're hearing members say, so this was the one where if you work any time over, if you're full time, over anything over 37.5 hours, you should be entitled to overtime. And what we're saying is, if you have to stay on after a shift or you haven't had your unpaid break, then you should be able to claim that back as overtime. Now, what we're hearing across the piece is that there is no robust method for this to be recorded. In many areas, people are not asked whether they want to take overtime or time off in lieu. And we're also hearing members telling us that actually, when they're asked to work overtime, they're being told you can do overtime, but it has to be on a bank rate, which is absolutely inappropriate, because you are entitled to overtime payments as part of your current contract. And again, I brought this up with your workforce directors last week and with Welsh Government as well, because it's completely not acceptable that you can't get your overtime for the hours that you're working over. Again, that's something that we together, with our reps, with you, we need to start sort of agitating in the workplace to say, I am entitled to this, so I want it, and I won't do hours unless I get it, that kind of thing. So that's really important. Next slide, please. So we now have a CPD strategy, a continuing professional development strategy that HEIW, Health Educational Improvement Wales, have done. But what we haven't been able to get over the line, and we've been very clear as trade unions that we want, it may be a stepped approach. So we can't go to pay parity for CPD with medics straight off. No organisation can do that. But actually, as a stepped approach, what we were suggesting is that we should start at 52 hours, because that is in line with Welsh Ambulance Service and what they are entitled to and what they get. And that is worked in with their rota and everything else. So we thought, use that as benchmark, as a stepping stone to then move in a proper fashion, in a stepped approach to parity with the medics. I have to say that NHS employers are quite anti putting any hours on there, and they're saying that this isn't achievable. But we have now got agreement that they will go and scope out with each health board what is practical, what can be offered. I have to say that in our meeting last week, I was very clear that actually this is one of our red lines, as we call it, that you know, our stance as trade unions is it should be a starter of 52 hours a year. Now we'll have to wait and see how that all works through when they do the scoping work, but again, a very frustrating element that that's not seen as a priority. Safe and effective care. We were promised an escalation plan, and when we were negotiating, we were certainly promised that we would be in the room and we'd be part of these discussions. We haven't been part of these discussions. It's my understanding that the escalation plan has gone to local partnership forums who are not happy with it at all. So it's now gone back to the drawing board to look at it again. You will see us out and about. We've been to a number of different hospitals, particularly A&E focus at the moment and SDEX, and that's coming out talking to members about what it's like working. Is there people being cared for in inappropriate places, whether that be in A&E, whether that be on the ward, community settings. So we are out and about, and you'll be seeing us a lot more over the coming months talking about this safe and effective care. And again, you know, we are really holding Welsh Government to account for this element. Pay restoration, so Welsh Government have committed to it, but what they're not doing is providing me with a plan about what pay restoration should be and how we're going to get there. And again, that's another issue that I'm really pushing Welsh Government on, because that's within their gift to be able to do. Appreciating that they say there's no money, but that's something that they agree to, but that they haven't done as yet. Next slide, please. And then this is the final slide. So retention. So there is retention plans. We've now got retention leads in health boards, which is a positive step forward. But what we're not seeing is the use of what we call recruitment and retention premia. So if you've got an area, any profession or any job within the NHS where it's difficult to recruit to, you can agree, health boards can apply to the Welsh Partnership Forum to have what we call an RRP, recruitment and retention premia, to be able to offer incentives to staff to work in that area. So one of the areas that we, you know, this could be used at the moment is in health visiting, for instance, where we have some health visitors who are finding it really difficult to recruit to posts, but they're being paid a band 6, whereas in other areas they're being paid a band 7. So the health board can come to Welsh Partnership Forum and ask that for a short period of time, until maybe job evaluation is done and new banding, that they could be paid as a band 7. But we're not seeing that. Health boards aren't even looking at it, and we've had no sort of tripartite partnership work on this as yet. The retire and return, so that policy has been done, and hopefully that will be out soon in the next couple of months. And the partnership hub, so that's just a hub, and Katie, who's very kindly posting some things up for us, is hopefully going to put in the Welsh Partnership Hub link to it, and that's where you can find all the information about Welsh Partnership Forum, all the information about NHS terms and conditions, and any new things that come out and updates such as mileage and things like that. So that's where we're at with the pay award. As I say, rather disappointing. We went into the negotiations in good faith. We agreed these things, we put timeframes on things, thinking that, you know, everybody in the room was signed up to making sure that they were implemented in the right time frame. Very disappointing that I'm now in front of you at the end of March and things haven't been implemented. But I do want to assure you that I have been very vocal right the way throughout this to say it's not good enough, not good enough at all. So I'll hand back to Helen.
Thank you, Nikki. I think I heard you say many times that you weren't happy with the number of areas of progress. Obviously, we are coming towards the end of March, and these areas are supposed to be delivered by then. And as you said, I know you, the staff and the reps and the stewards and the safety reps and the learning reps are all out and about in workplaces. So if you are on the call today, look out for us there, and please join in the conversation, because we need to know how you feel about this as well. And it did make me reflect back on when the deal was put on the table, and then the difficult decision I think that members took to vote for this deal. And at that time, there was a degree of cynicism amongst the membership saying they're not going to deliver these things. And it looks like some of that is coming to fruition, which is disappointing. On the positive side, it was nice to see some of the positive aspects that have happened, as you were talking about there. There is a new flexible working policy out. There is the new social partnership hub where information can be shared. There's work happening in terms of continuing professional development opportunities and career and job evaluation, etc. But I share your issues that the pace is not what we expected. And actually, it's not what was promised to us in that deal. Okay, now I know that some of my team are having some technical issues with Teams, certainly in terms of publishing some of your questions. So please do bear with us whilst we make sure that all works out. I can see that the Welsh Partnership Hub link is there for you. Do please carry on putting your questions into the chat so that we can publish them. But whilst we're sorting those technical issues out, I did have a number of questions that members have raised outside of this evening, but in their places of work, which I thought would be helpful for the panel to answer in the online forum, because these are questions that are quite commonly coming up. Okay, so I think I'll start the first one. It's quite a important one because it's in the moment, if you like, and that's about the junior doctors strike and that link to our pay deal, etc. So whilst we've been out and about the last few days, lots of people have been asking us, well, the junior doctors are out for 4 days. This is their second day today. What will happen if the Welsh Government decides to offer them something more for last year than has been offered to Royal College of Nursing members? So that's my first question. I do enjoy putting the panel on the spot a little bit, but they also like to answer as many questions as they can. And I'm going to start with Nikki on that question, please, Nikki.
Lovely, thank you, Helen. So yes, the junior doctors are out. As far as I'm aware, there's been no ability for them to have any negotiations at this point. So we've just got to bear that in mind. So if the junior doctors got more pay for last year, and they did get less in Wales than actually in England, then I think we would have to think about, no, we're not in a dispute with Welsh Government any longer, because members accepted the pay award in what was it, August, September last year. We're actually no longer in dispute with the Welsh Government, but that doesn't mean that we can't go back into dispute with them. So we would be needing to come out to talk to you about how you felt about that, and whether you wanted to go back into dispute with the Welsh Government in whatever guise that looks like, and that could potentially be strike action sometime down the road. Obviously, where we're at the moment is that the pay for 24-25 is sitting with the pay review body. So at the moment, we don't know what pay award we will have for this year. I mean, it's likely we won't know that until the end of May into June, possibly July, with the government that we've got in the UK at the moment. So my thinking is we'd probably need to be looking at what happens with these non-pay elements, 2, where our pay goes for this year, because they might say, well, they'll work it out, and you know, the junior doctors can have more for last year, but then they'll work it out with us and make it right in the 24-25 pay round. So we really have to see where we go, but there's no reason why, if members feel that they're aggrieved, that we cannot go back into a dispute with Welsh Government, and obviously members will then have the say about what that dispute looks like, and whether strike action is an option moving forward.
Thank you, Nikki. Does either Jackie or Kelly want to add anything to Nikki's answer on the link to the junior doctors? Happy she's covered it. Super.
Yeah.
Thank you. Okay, so first question that has been published in the question and answer is about the 36-hour working week. And the questioner is asking, when will the 36-hour working week be implemented? Kelly, did you want to start on this one?
Yes, I can. I think we just need to be very aware, Helen, that the pay award was actually to look at the feasibility of working 36-hour week. It wasn't to implement the 36-hour week. And I know many of our members, since the announcement in Scotland recently, where they've announced that they're implementing a 36-hour week, I think that's really revived the discussions with our members as well. And again, Scotland have been looking at this over the last 2 years. This is not something that's been implemented quickly. This has taken some time. As Nikki said earlier, with the pay review in the presentation that was carried out, there is still lots of work to be done on the 36-hour week. And one of the big issues that we have pushed for is to actually really look at the feasibility. What the employer side produced recently to Nikki in the discussions and to the other trade unions wasn't good enough as a feasibility test for us. It wasn't looking at the costs, or the savings actually within the 36-hour week. We know many of our members work varied shifts that will have an impact, and many of our members will actually probably could potentially do more work as a result of dropping the 36-hour week, as dropping the contracts to a 36-hour week. So there's lots of discussion still ongoing. But I think we have to be very clear with the members that the agreement was not to implement 36-hour week, it was to look at the feasibility. And that's what we are still holding Welsh Government and the employers to account on. Hopefully now, I think there's a meeting tomorrow, Nikki isn't there, we'll be looking further at this again. But for now, the RCN is, and Nikki is doing so much within the meetings I've attended with her to keep the employers looking at this as a real issue for our members. It's a red line. Many of the members, when we sent the survey out in December, 36-hour week was a real big priority for our members. So it's something that the RCN will continue to push for.
Lovely. Thank you, Kelly. I'm going to move to our next question, and this is one about flexible working. We were just recalling that the flexible working policy is now available. So if you haven't seen your organisation's branded NHS Wales flexible working policy, please go and find it. You should find them on your intranets, etc. If there is a link on the web, we'll try and look for that for you as well and pop it in the chat bar. But the questioner is saying, I've applied for flexible working and it was declined. So what does that mean? And it doesn't seem right to me. What can I do next? So Jackie, this is your bread and butter as a steward in your health board. I'm going to ask you if you'd like to go first on this one.
And interestingly enough, I've had a few queries just about this in the last few months. So obviously with the policy being revised and coming out, and the policy making it clear that the default position should be to agree flexible working, and that it should be made easier, for people. The people that have contacted me as a local rep are also saying that, well, my manager he said, oh, I can be flexible. Yes, don't you worry, I can give you what you need, and wanting to keep it very, very informal. But the problem of any kind of informal arrangement is that you have nothing to fall back on when a manager says, well, I can't accommodate what you want for the next, few weeks. So obviously the policy has a very clear process where you can apply in writing, and obviously you're meant then to have a meeting to discuss what you're requesting. And unless there are very obvious detrimental impact on the service, then there should be no reason why your flexible working request isn't accepted. And then the beauty of that is then you've got something in writing, something formal, so you can say, well, actually I've got this in place. It's agreed I've got it for 6 months, and then we're going to review it, because it's important to review these things. But you've got that little bit of security knowing that that agreement is there, at least for a determined time period. And for me, it's like, as nurses, particularly when it comes to sort of documentation or things that happen on clinical areas, it's instilled in us. If it isn't in writing, it didn't happen. And that's the kind of thing that is coming back with some of the members that I've had discussions with recently who've contacted me, said, oh, but I was told I could have flexible working, but they've got nothing in writing. They didn't really follow the policy or a proper process. So it's good that a manager might be trying to be supportive, but you do really need something more formal so that you've got that agreement in place.
Thank you, Jackie. And of course, there's some legalities changing as well about flexible working in April of this year, which mean that your employer is now going to be limited to a time limit of 2 months from the point that you apply right through to if you needed to have an appeal. So as Jackie was saying, that sort of formal element of the process can be very helpful. Thank you. Okay, now this next question is a bit of a cracker. I really like this question, and whoever asked it, if you're not already an RCN rep, you definitely need to be one. And I'm going to ask the team to drop in the how to become active in the RCN link in as well. And I think I'm going to let all three answer this, but I'm probably going to start with Nikki. And it says the question is saying, sorry, they're a bit late logging in, but their question is, what barriers are hindering the implementation of the non-pay elements that are supposed to be supporting nursing in Wales? Good question. Nikki, I'm going to let you go first.
Yeah, and I'm going to be really honest with you. I think there's a number of elements. So Welsh Government are hiding behind the fact that there's no money. So the 36-hour week will take some money. They're saying that they would need to have 3.9% extra on the budget to be able to implement that. And obviously not, it would be staged over a number of years. So it's not 3.9% over 1 year, but they're saying that they haven't got the money to do it. And with CPD again haven't got the money to do it, because if we haven't got people, if we haven't got people on the wards or in the clinical areas of community because they're doing study, then actually we need to replace that person. So Welsh Government are very much hiding behind there's no money, and we have to give up something to be able to have what we've wanted in the pay award. Now again, we went into this in good faith and they agreed to it. So to now say there's no money, it really doesn't cut the ice for me at all. I think the other issue that's a real big issue is health boards and organisations not really wanting to implement some of this stuff. They see some of it as a problem in terms of staffing, so the 36 hours, flexible working. You know, they again are saying that they've got financial constraints, so they can't offer overtime when they should be. So I think there's not the appetite in some of the health boards to actually implement this. And I think that's where you come in, and our reps and our staff will be out a lot. As I say, we need to agitate in health boards to say, this is really important to you. These things are really important. And, you know, from a morale point of view and from a retention point of view, it's a real must that these health boards and organisations implement these things. So I think there's a number of different elements to it, but there is not really the willingness, I don't think, there from either side to take this forward, which is a real shame.
Thank you, Nikki. Jackie, do you want to comment on what you think perhaps the key barrier is stopping the implementation of this deal?
I think I fully support everything that Nikki's just said. There are two things for me. One, yes, the money, and we're hearing about the health board's going to be in significant deficit positions financially, and how can we make more savings? And there's going to be difficult decisions being made. But also, I think some of it creates an inconvenience in terms of, you know, bringing it in. All I will say is, and this is the message from the members on the ground, as I said, I'm a local rep, is that people voted to accept the additionality because they were more or less told there is a genuine commitment to working towards these things, to deliver them and bring them in. So the barriers created by the health boards are really unfair and inaccessible. And locally, I don't really see the health boards collaborating and making any effort to work towards these additional components.
Thank you. Kelly, any thoughts from you?
Yeah, I think just to add, I think, many of the health boards have put the work that has to be done in the too difficult box. Flexible working is, the policy is there, but actually in reality, is it going to make a difference for our members? We as reps, as officers, as staff within the RCN have to make sure that our members are getting what they deserve. So, lots of the work within the, sorry, my dog's going to go off. Lots of the work that is being carried out by the RCN and the work that is being looked at, what we have to really make sure of is that the employers don't get away with this. We knew a lot of the discussions were going to be long. We knew that many of the negotiations were going to take some time, but the continual pushing things into the long grass and trying to kick it as kick the can down the road as long as they can, it's not good enough. So we really have to ensure that our members are asking for what is going on, where are we with the non-pay elements, not just to the RCN, but actually to the employer side as well, and making sure that their voices are being heard and that they're not happy with the progress that's being made.
Thank you, Kelly. Yeah, as Nikki was saying earlier, a number of these non-pay elements are already your terms and conditions. So if you don't know who your local rep is, go and find your local rep and have a conversation with them, particularly around the getting paid proper overtime if you're working over your 37.5 hours because you can't get off shift or you couldn't take your lunch break, etc. Activity in that space will create some focus on these issues, and that is an absolute key point. So if you don't know who your local rep is, go and find them, and maybe become one as well, because we need you, our members, to be really firm that this means a lot to you. Tell us your stories as well. You can use SenseMaker, which will pop into the chat for you, that you can tell us about what your experiences are of asking for flexible working, getting paid overtime when you've had to work on, being incentivized to do a bank shift rather than an extra shift on a high cost agency. We want to know what you think, and we need you to be in the space where you're using your voices, because together we can make a difference on these things.
Helen, can I just come back in on one thing? With the overtime working and members not being able to get overtime rates of pay, which they should be, as contractual right, there shouldn't be any discussion on this. What we've been challenged with is finding the evidence. And what we are really struggling with as RCN is members wanting to come forward and give us the evidence to give to the employers that actually members are being told to go into bank work and paid at bank instead of receiving the overtime payment that ask members to do is to give us the evidence, allow us to support you and continue with this, the challenge to the employers. But we are raising the voices. When I'm in the hospitals visiting, I'm raising these concerns with the employer side. It's coming back to, well, give us the evidence. As far as I'm concerned, our word should be good enough, but the employers are asking for more. So our members really need to be raising these concerns through the proper processes, through the reps. If they're not receiving the contractual rates of pay, they should be raising this formally and addressing the situation. So just ask for a bit of help really from our members.
Thank you, Kelly. And I will also ask the team to pop into the chat how to contact us through the contact centre, RCN Direct, or the web chat, or the email to tell us how and what is happening in your places of work. I suspect for a number of members, there's not even bank rates. It's more put it on your time owing, and then of course time owing never comes. And Agenda for Change is very clear. If you can't take that time owing within a period of 3 months, you should be being paid for it. So let us know, talk to us, and let us help you with the tools where you can raise these issues too. Lovely. Okay, I'm going to move on to our next question because we've only got 5 minutes left, and I want to get this one in as well because it kind of relates to what we were just talking about. And panel members, take leniency to take that focus about what you think individual members can do or what groups of members can do when you want to answer this question. And the questioner is saying, why is my employer only offering additional hours on the bank and not as overtime when I've completed 37.5 hours? Jackie, I think I'm going to let you go first with that one. Thank you.
Because it's cheaper for them. That is why. But the reality is your terms and conditions mean that you are entitled to be paid overtime. When you've worked that 37.5 hours, if your manager wants you to work and your condition of working is I want to be paid overtime, then you stick to your guns. They cannot force you to accept payment via the bank. It's as simple as that, and it does boil down to money. They want to have the cheapest option. They'll have a criteria which will be, or we'll go to people who are part-time first, so they just work hours up to 37.5 because they're the cheapest. And then we'll go for our full-time staff, but we'll only offer them bank. And if we can't fill a shift, then maybe we'll go to agency. And they seem to have a mindset that overtime is the last resort. Well, actually, paying a substantive member of staff overtime is often cheaper than agency, but the value in terms of the safe care and the outcomes for patients, that there's no price you can put on them. Do apologise. So if you've got a member of staff on your ward who's worked there before, knows the patients, you know that member of staff is going to be safer, and that is the value of paying somebody overtime.
Thank you, Jackie. Nikki, did you want to say anything on this question about being offered extra hours on bank only?
I suppose so. As Kelly says, we need the evidence to take back to employers, because what employers are telling us is we can give you evidence that nurses are being paid overtime. So it's really helpful to be able to go and provide stories and say, in this area, this is what's happening. And I suppose it's like Jackie said, it's about keeping as a ward or as a team out in the community, you can get together with your colleagues and start saying it as a collective, because it's difficult, isn't it? If you stand up and say, oh, I'm not going to do it, I'll only do it on overtime, then your colleague will go, oh, go on, then I'll do it on the bank. Then that's not helpful. Whereas if you could rally people in your area to all say the same thing, well, actually, no, we're not going to do it on bank. We'll do it as overtime, and we're here as a collective. And so you can't go to the lady next door because actually she's going to say the same as me. So I think there is something about putting our expectations. There's also something about making sure that the recording of overtime and hours worked over is robust, because quite often, we hear about time owing books being locked in cupboards, nobody can access them. We hear of people saying, well, the shift lead, they didn't agree for you to have overtime, but they asked you to stay on. So it's getting some of those things in order, and really you as a members on the ground can actually be really powerful if you get together and have a mantra of the same message that you want to get to your manager.
Thank you, Nikki. And I'm going to sneak in a very last question, because I think there's a number of people who want to know the answer to this. And this question is, what's happening with the pay negotiations for this year's pay? And as our chief negotiator, Nikki, I'm going to let you answer this one. Thank you.
Thank you. So last year was peculiar in the way that we did go into negotiations and we did manage to get an enhanced pay award. And in fact, we got a better one than in England. So that was a one-off. The minister has actually written to the pay review body, who's meant to be an independent body, who look at all the evidence and then come up with recommendations about pay. They are very much linked to the government, so how independent they are, we're really not sure. So actually, they've called for evidence. So we've now provided evidence specifically to Wales from the RCN, as well as UK data as well. And we are waiting for the pay review body to come out with recommendations. We are hearing that there's a possibility that will come out in May, but sometimes this gets stuck with the UK government, who, if you remember when we've had previous awards, didn't actually say what the recommendations were or accept the recommendations till July, and then they disappeared on recess so that nobody could question them on it. So at the moment, it's the way the minister wanted it to happen was that it went through pay review body, recommendations will come out later in the year, and then we will have to look at what those recommendations are, and we may have to come out to you as members to ask what you think about it, and what next steps do you want to take, whether that be a dispute. But it's very much in the hands of the PRB this year and not negotiations.
Thank you, Nikki. So we are drawing to a close of our session this evening. It just remains for me to say a big thank you to our panel members for answering your questions so eloquently, and also to Nikki for presenting the update on where we have got to in terms of this pay award. Please encourage your colleagues to come along to future events. I'm sure there'll be a number of those over the next few weeks, particularly as we move into the space where we do know what the pay review body recommendations are. Also, please consider being engaged and active in the RCN. Contact your local branch. You can find that on the website. Contact us through the contact centre, or come along and meet us when we're out and about in your workplace. And of course, don't forget to make sure that your workplace has got an RCN representative in it. Our next events will be published on our website, and they'll also be on our social media platforms. So follow us at RCN Wales on X and Facebook and Instagram to make sure that you are up to date with what is happening across the RCN. So it just leaves me to say have a lovely evening, and diolch yn fawr iawn for joining us, and I look forward to our next session with you all. Take care, good evening, noswaith dda.